Hello, welcome to Canvas, the Niger-Delta Roundtable, where I discuss the future of this region blessed with hydrocarbon resources. Every week, we give time to reflecting on topics that are relevant to the development of the Niger-Delta and to people. And this episode is no different. I'm here still, and we're focusing once again on how to take our region to a more promising future. And the podcast is sponsored by the operator of the NNPC, Renaissance Total Energies AENR joint venture, Renaissance Africa Energy Company Limited, headquartered in Port Harcourt. Thank you for joining. I'm Adedayo Ilushakin. Topic for this week, the prostate conversation. Today we're having a conversation that many men avoid, postpone, or simply don't know enough about. We're talking about the prostate. For many men, the prostate only becomes a topic of interest when there's a problem, a troubling symptom, a hospital visit, a diagnosis. Yet the truth is that understanding prostate health early can make a significant difference to quality of life and long term well being. Now, despite growing awareness, myths, misconceptions, fear, and silence still surrounding conversations about men's health, too many men ignore symptoms, delay seeking help, or rely on misinformation instead of expert guidance. Today's episode is an opportunity to change that. We'll explore what the prostate is, how it changes with age, common health concerns, warning signs men should pay attention to, and what every man can do to take charge of his health. Today, again, our topic on Canvas is the prostate conversation. And my guest is Dr. Ovunda Jack Omodu. Professor Ovunda Jack Omodu is a renowned consultant urologist and professor of surgery with extensive experience in prostate care, urology, and minimally invasive surgery. A fellow of the West African College of Surgeons, he has played a pioneering role in advancing specialist urological care in Rivers State and Nigeria. He is the founder of the Prime Rose Prostate Savers Foundation, which provides free prostate screenings and surgeries for underserved patients, and the chief medical director of Colwarts Medical Center, Port Harcourt. Passionate about men's health, Professor Omodu is committed to raising awareness, promoting early detection, and improving access to quality prostate care. Dr. Ovunda Jack Omodu, hello, welcome to Canvas the Niger-Delta Roundtable.
Thank you. Welcome, viewers.
Thank you for coming. Uh, Interestingly, your invitation and your appearance is probably one of the shortest versions I've ever had. It was one phone call. Of course, Donald had, I believe, had a conversation with you before then, I suppose. And barely a day or two, and here you are. I usually have a longer conversation. Sometimes have to coax the guests and do some convincing work to have them here. But that experience and a bit of the conversation we had before we say recording gives me some insight into you. Now, besides the amount of work you put into your craft, which I suppose you do care about a lot, and you did mention this as well. You do enjoy lecturing, teaching, and enlightening people. And that says quite a bit about you. Oh, you agree with me?
Yeah, I agree with you. 100%.
So I'll ask you a question that I asked before we started recording as well. How do you make out time for all of this? I mean, you have an extensively busy schedule, working very hard, and then you teach, and then you had surgery today. I should point that out. You had surgery today before coming for the recording, and you still made that time to be here. How do you do it?
Yeah, well, I'm not a superhuman, but it's about time management. I try my best to meet up all my obligations. I'm a teacher, I'm a lecturer with the River State University and also with the Palmo University of Medical Sciences, professor of surgery, professor of urology. Well, I love impacting knowledge and giving back to the society. So what I do is to just apportion my time to the things I need to do. For example, I had to wake up very early this morning by 4:30. I was already up By 6 o'clock, I was already in the theater because I knew I had to be here by 12. So I had done my surgeries. Of course, whenever I do surgeries, I teach my doctors, I teach my nurses, people around there. So if even the patient is awake and we're discussing about the surgery. After that, I knew I had to come here. And I always attend to my duties on time. That's why I came here even before 12. Before 12.
That's why they got it before me as well.
Yeah, I got here before you.
And I apologize for that again.
The problem. No problem.
um, what is a prostate and what does it do?
Well, the prostate, it's a gland that is found only in men, not found in women. But the symptoms and the signs and the problems of prostate traverses the men to the women and the children. What do I mean by that? The sequelae or the complications which affects the men, because the man is usually the breadwinner. So when the breadwinner is not good, it affects the children and the wife. So the source of income is reduced. So the man is attending to his own health, and the children cannot have their fees paid because the man has to be healthy. Now, this prostate gland, it's a small gland the size of a chestnut or a walnut, which rests between the urinary bladder and the urethra. What is urethra? It's a tube that takes the urine out from the bladder to the exterior, that traverses the penis to the exterior. Now, if you look at how the prostate sits encircling the urethra, then you will understand when I'll talk about the signs and symptoms of prostate, how it affects urination. Because if it enlarges, it will compress the urethra. So if you allow me go on and on, I can go on and on. You need to stop me. I'm a lecturer, so I can keep talking for the next 3 hours.
Okay, consider this an introductory class.
Oh fine. Oh fine. Oh fine. So with the prostate, the normal size is less than 20 grams in the young adult. Now, every decade it starts growing. So what makes it grow? Every man has a hormone called testosterone. That's what makes you a man. What makes the woman is the estrogen hormone. That's the female hormone. So if the male hormone testosterone dominates in any child or any baby in the mother's womb, then it will turn towards forming a male child. But if the estrogen dominates in the womb of the mother, then it will end up forming a female child. So it is the male hormone that makes us to be man. Now, that male hormone called testosterone is now converted to an active agent called diethylhydrosterone, which is the primary cause of prostate enlargement. So, with that hormone being in us, our prostate is bound to enlarge. Now, when this enlarges over time, then the symptom will start manifesting. And of course, it is a disease of aging. So, every man, once you start getting your gray hair, you know that your sight has started diminishing, arthritis is setting in, then just know that prostate will soon show its ugly head, just like hypertension and co. So every man from 40 must always check the prostate gland.
For children that are growing up, especially those who have attained the age of puberty, there is that conversation that every parent or most parents, I think, dread to have with their child, and sometimes it's described as the talk or the conversation. And basically, it's the conversation about sex. One that it's been argued several that parents need to have with their children, but still, even those who know that dread that conversation. And I think that the version of that for the male adult is the prostate talk or the prostate conversation.
Exactly.
And which is why I titled that, this conversation, this episode, the prostate conversation. Why is it one that prostate talk or conversation, one that a lot of men avoid, so to speak, or and willing participants of?
Oh, well, I would like to enlighten men. It is a disease that we should never avoid hearing. I keep speaking about it. I talk about it anywhere I go to. Because prostate cancer is the number two leading cause of death among cancers in men. No urologist wants to see an end stage or high grade prostate cancer patient. Is it is it's a terrible disease. So we must avoid it. When I come to the treatment, I'll tell you what we must avoid. It's a very expensive disease to cure.
Now, any disease is bad, I guess.
Yeah.
Nobody
But
wants to
some are
have.
better.
I presume so.
Yeah.
But then but nobody wants any disease of any kind. But you often hear, ever so often, when ailments that are especially peculiar to the male gender are discussed, the prostate is arguably one of the most common ones that comes up ever so often. Why is that so? Why does it seem so crucial, so high up, if I may use that expression, on the list of male diseases?
Yeah, because now every 10 men of age 60 and above that you see, 1 to 2 men amongst them have prostate cancer without knowing. So it is that common and that bad. So every 10 men you see in the street over 60 years, 1 or 2 of them are carrying prostate cancer.
Why is this so predominant?
It is a disease of aging one. It is a disease that is mostly affecting the Negro, the Black Americans, the Africans, the Black man. So it is it is there to stay with us. And let me tell you the problems that it can cause. Now, prostate cancer, it stems with what we call lower urinary tract symptoms, which are frequency of urination, for which can have some other causes. You know, the weather, this is July, so the weather, people pass urine more frequently now because of the weather, because you don't lose heat much now. Then you have the one you call urgency. Before you get to the toilet, you've already wet yourself. Then frequency at night, before you wake up in the morning, you've already passed urine like 3 or 4 times. Then we'll now talk about passing blood in the urine. Your urine stream not coming straight, scattering. Then at the end of the day, at the end of passing urine, you still feel some residual behind. Then we start having people come down with anemia. Anemia is a shortage of blood. Then bone pains, terrible bone pains, backache, and all that. But these are symptoms that could coexist with other diseases. So that is why we always say patients should go and see their urologist so that we can decipher which is which. And prostate cancer, no man should live a world of denial. It is amongst us. And that is why we talk about early screening and early detection. This is what will make us stop people from dying from prostate cancer.
Yeah, but if you check something, I mean, you've been a doctor, and with your years of experience, you must have heard this. If you go to a doctor to check something, they're going to find something. You always,
We will find
you
something.
guys always find something. So
Yeah.
so maybe if we don't go to check, then you don't find anything, and then supposedly I'm fine.
Yes, people talk about things like what you don't know will not kill you. But that's the ignorant part of human being. I mean, you don't blame them because we're not static, we're dynamic. The body is not 100%. Okay? But when we check the prostate, we may not find anything, but we may find something in other parts of your body, which we may refer you to a specialist, but which is good for the person. It's good for you. If we can take our cars regularly to the workshop for servicing every 6 months, why can't we take our body for servicing?
Maybe you do. I don't think most Nigerians do that.
Okay, even if we take their vehicle every year for servicing, why can't we take our body for servicing every year?
Is it a job of doctors to always find something? I mean, are you? Is there a compulsion to find something?
No, most it depends on what you're looking for. There are times that a patient comes with your presenting complaint, and we investigate along that line. We may not find anything. We don't have to investigate from your hair to your toenail. But that which you came for, there are times we don't find anything, and we give you another appointment to come for checkup.
Like with most other illnesses, especially the more common ones, like prostate related issues, prostate cancer, and the like, there are certain myths, misconceptions, uh, half truths, total fallacies. What are some of these? that are very common?
Well, the common one is people say that when you have regular sex 21 times a month, that it will prevent prostate cancer. That's is not very true. It's
Some people who are said to be medical inclined have propagated that as well.
well, there's no scientific data to support that. None to support that. I'm a professor of urology, and we've looked at several researches on it. Not so that is even amongst the list of the prevention of prostate cancer. So we cannot bring that to the fore. So everybody will keep listening and keep imbibing on it. But there are other sequelae of 21 times sexual intercourse in a month. I mean, are you not going to work? I mean, you don't have any other thing to do. And you know that scientifically, one episode of sex, you should know the how many calories that you burn. They say one orgasm from a man is equivalent to one set of lawn tennis.
Isn't that? Don't doctors like? Don't you advise us to burn as many calories as possible?
No, you should burn calories that are channeled to what you should burn. That is why it's not everybody that will benefit from certain kind of exercises in the gym. That's why you have gym instructors. You can't just go to the gym the first day and start carrying and start lifting weights. It's stepwise. So even if that may come in as a preventive measure, which I don't even adhere to, okay, it should be stepwise, not you live your life sex. No,
All right. So
there are other preventive measures if you want me to tell you.
we'll get to that. So
Yeah,
even if you change your middle name to Randy Casanova,
yeah.
it doesn't protect you from a possible case of prostate cancer.
Randy Casanova will come with his own problems of emptying your pocket, problems of getting tired all the time, problems of lying to your spouse or to or somebody, or problems with Randy Casanova. There are so many problems with it.
Mm.
And I'm sure Randy himself will also know that he has problems.
Well, I will inquire from Randy once I meet him. Is every prostate problem a sign of cancer?
No, 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 no. The prostate has different kind of diseases associated with it. You can have normal enlargement of the prostate, which we call benign prostatic hyperplasia. We can have infections in the prostate, which is called acute or chronic prostatitis. We have tuberculosis of the prostate. We have stones in the prostate. We have cancers in the prostate. There are other diseases that affects the prostate. But the bad one is the prostate cancer.
Tuberculosis of the prostate sounds bad. I don't know why. Maybe because my understanding of tuberculosis
Yeah.
implies, or the symptoms is a very bad case of cough, which is terrible and all of that. So,
Okay.
how do you have tuberculosis of the prostate?
No, you have tuberculosis. Tuberculosis is anywhere in the body. You can have tuberculosis of the spine, of the intestines, of the lungs, of the prostate, of the testes.
Mm.
You know, tuberculosis, why is common in the lungs is because it's manifesting with cough. All right, because I mean, lungs is what it aids in the breathing of air of oxygen in and out. So, but there are parts of the body that can suffer from tuberculosis.
When should a man be concerned about urinary changes? Because I mean, even as a child growing up, you experience different things with urination. As a teenager or as a young adult or older, I mean, you have different cycles, you have different experiences. So, what sometimes there's the coloration, deep coloration. You hear drink a lot of water, a lot of fluids. It's going to clear out. It does. Sometimes it's all over the place. Sometimes it's normal. So, what are the signs? What should be concerning about it?
Yeah, you know, as a child, I'm sure you played this game. You know, as a child, we can line up and start urinating, and we try and see how farthest our urine can go. I don't know if you played it, or
Mm.
you point your penis up and see how high your urine can go.
No, I was playing video games
You're
then.
playing video games then. Okay, well, we grew up in days where there were no video games, so we had to play with our urine and how to draw your name on the floor with urination. But you know that is a childhood game.
Mm.
As you get older to 40, you will know that you can't even direct your urination upwards because prostate is growing. You can't. And it's not every urinary problems that are caused by prostate. There are other urinary problems like urethral stricture, stones in the urethra. They can also cause the same symptoms that prostate can cause. That is why the proper doctor is the urologist that will decipher which is which. So, but once your urine system has started changing in your own perception, then you should visit the urologist.
What is that one sign or symptom? I mean, there are things that you may want to observe over a period of time,
Mm.
like a week or two, to see if there's a consistency or if it changes before raising an alarm. What is that one sign or two, maybe, that you see and you know, okay, you know what, I'm calling my doctor immediately?
Yeah, well, I would say when you have frequency of urination, because frequency will not allow you to think, will not allow you rest, because you're always getting up to go and pass urine.
What is frequency?
Okay, frequency is the number of times you pass urine. In the night, you should wake up not more than twice in the night to pass urine. That's normal. Not more than twice. If you find yourself waking up more than twice in the night to pass urine, it's a problem. Then,
What if you had a long night with the guys?
oh, fine, fine. Then there's a reason. Then you already know there's a reason. You took lots of alcohol, you took lots of water, you took lots of tea or coffee, then you know there's a reason. But if this happens consistently, without you taking these things. All right. Sometimes there are some medications that we give for hypertension that can make you pass urine a lot. But so if you are confused in all this, just see the urologist. We can decipher which is which. So there are so many diseases that share symptoms with the prostate. Yeah.
So if there are no concerning symptoms per se, I'm urinating properly. The figures, the numbers are okay. Of course, I mean at age 30 or age 40, I can't. I'm not expected to urinate as far as I was when I was 10 or 15, or as high as I did when I was 10 or 15. But should I just check? Is that something that should just happen? Should I just check? And if you're advocating just checking, I mean there are million and one diseases out there. Do I just randomly, for no apparent in quotes reason, just check for everything periodically?
Well, specifically for what we're talking about, prostate. Sometimes prostate cancer can dwell in a human being without symptoms. It's called occult cancer without symptoms, but it's growing inside you. So without screening and without checking, we may not know. So it's important to check. So it's not all prostate cancer that will manifest quickly with those symptoms. So we need to check. That's why we always advocate for screening from age 40. Very simple test to screen. It's not expensive, but most men don't go to hospitals. Most men will send their daughters and children to hospital, but themselves. They'll prefer to go and get some drugs from nearby shop and now man it up that yes, I'm a man. I'll be okay.
When you say not expensive, I mean we have challenges of access to healthcare in Nigeria. It's a general thing.
Yeah.
One of the reasons for the challenge with access is cost of healthcare. So when you say not expensive, I mean the reason a lot of people don't access healthcare also because they can't afford it. Now, if even when I'm ill, I can't afford healthcare that I desperately need, and you're recommending that even when I'm not ill, I should just go to the hospital to spend money that I probably don't have.
You know, there's a saying that goes, prevention is far cheaper and better than cure. The affordability of healthcare is when you're sick, it becomes a problem. But when you're just going for normal screening, normal checks, it shouldn't be expensive. And remember, there are still areas in this country where there is free medical care. And of course, remember we have the Nigeria Insurance Health Insurance Scheme. Remember we have the HMOs coming up. So there are still avenues where one can key into and have your regular screening. Also, remember that I talked about some free screenings that I do every September every year. And I'm just one individual. There may be other people that are doing prostate screening. So once you hear anywhere screening for health, just cash in on it and go in. It's free.
Mm.
So it's just a mindset of no, it's expensive. I won't go there.
Now, there are those, like you described, those who take their car in for service in every 6 months or thereabouts, or at least periodically.
Yeah.
Just like there are those who afford themselves some medical checks periodically, maybe twice a year, and all of that. But usually they would simply go to their GP. You know, is that enough? That you're seeing your GP once a year, twice a year to do your regular full body medical check, or do you have to schedule something with a urologist, with a specialist?
Yeah, the GP is also good enough if it's for screening. All right. So normally in every tertiary institution, you go through the GP first. So the GP will now refer you to different specialists that you need to see. So the GPs are okay because I mean, how many specialists do we have in the country to take care of every man? So if they go to their GPs, it's okay. Their GPs can now see that they've done some tests and these numbers are high. Then I think you need to see urologists. So the GP will put a call across to us and say, "Look, we're sending Mr. X to you, and these are the numbers, and just go take care of him."
It is Canvas the Niger-Delta Roundtable, and we're discussing or having a conversation tagged the Prostate Conversation, which for some reason seems very difficult for some men to have. One of the reasons I suspect might be the actual test itself. We'll get to this and more information on this all important matter when we return from this break. Please stay with us.
In the heart of our journey, where the sun touches the earth and the wind whispers through the trees, a new chapter unfolds. A chapter where energy illuminates more than just bulbs. It lights up minds. A chapter of unity, a coming together with a common goal to energize futures and illuminating lives. In classrooms, young dreams evolve, inspired by the promise of a brighter tomorrow fueled by available energy. Small businesses flourish, becoming seeds of prosperity. Energy that empowers and is catalyst for growth and change. The future is energy. So, let's light up the path to a sustainable future together. Energy for you, me, and the world at large. Energy for people and planet. We are Renaissance.
Welcome back. Still Canvas, the Niger-Delta Roundtable brought to you by Renaissance. I'm Dio. Dr. Jack Omodu is still here with me, consultant urologist, professor of medicine. You're welcome again.
You're welcome. Thank you for having me.
And we're discussing the prostate, or we're having the prostate conversation. I think is a better way to put it. Um, at what age exactly? I know you inferred or even mentioned a figure, an age earlier on, but at what is the earliest age at which a man should start paying close attention to the prostate health?
Once a man has hit 40 years, once you've hit 40 years, you must, as a matter of must, you must start paying attention to your prostate health. Not just prostate health, your blood pressure, your vital signs. You must, because from 80, the body starts changing.
You mentioned a while ago at the start of this conversation that the prostate cancer and other such ailments, prostate specifically, are aging diseases. You used an
Yeah,
expression similar to that
yeah.
or something of that nature. At 40, most men would say that they're still young, still vibrant. And you can, I mean, how can you be talking about aging diseases? I'm just 40 years young.
Yeah, that's your 40 years. Those diseases may not come when you're 40. But the 40 years, it's the period where you prepare yourself to combat those aging diseases that may come. After 40, hypertension may start creeping in. Of course, your hair starts graying from 40. You may see one or two from 40. And of course, the sight will start diminishing from 40. All right. Then by the time you start getting 50, part of your bones. I mean, if you want to try it, you can go and do backflip. Then you know that you're 40 years. You know you're 40 years. You know, they say your body will tell you when you're 40. But some people are lucky, all right, they have very good, fantastic body, even at 60. Fantastic body, particularly those that are asthenic. As those are athletic. They are not fat, you know. People that are slim, they seem to have better parameters, all right, than the fat ones.
Like chef.
That's why we say that we should have a good body mass index, you know, and
Mm.
all that. But from 40, you must, because those things will start coming in.
How important are routine screenings? And by routine screenings, please note that screening is in plural with an S. So is this suggestive that the screening is not just a one-off thing, but regularly, like taking your car in every 6 months? So prostate screening, how frequently should that be done? If it should be done periodically.
Yeah, the simplest screening, the simplest and the easiest one for you or for us that are men from 40 is to do the simple one called prostate specific antigen, which is PSA. You can do once in a year. You can do twice in the year if there's a history of prostate cancer in your family. Then once a year is not enough. You should do twice a year because prostate cancer runs in the family. It can be hereditary. So if one's dad, one's uncle had ever died or suffered prostate cancer, then you must do twice in the year. But there are other complete screening that can be done if one has the resources for that. All right, there are other ones, but the basic one, the simplest, the basic is the blood test, which is called prostate specific antigen, for which the normal is 0 to 4. If it is above 4, then you can see your urologist. That the PSA, which is what I just said, specific antigen, PSA, that it is above 4 does not suggest, does not mean that one has prostate cancer. It only suggests that we should screen further, that you might have prostate cancer. All right?
Mm.
So that's a very basic monitoring and screening tool that every man should do at 40 and above.
It appears to me, and maybe some other persons, that the reason men avoid this conversation, or some men, or a lot maybe, avoid the conversation is also due to the screening. From my understanding, one of the screening or the test for this is considered somewhat intrusive, if I may use the term.
Yeah, well, some are intrusive, but some are not. So the simple one that is the PSA, which is blood, that is not invasive or intrusive. Why are they running away from it?
But that's the thing. Most people's understanding of the prostate test or check is that it is intrusive.
Yeah, because in the past, we used to use our finger to do what we call digital rectal examination, where we insert the finger into the anus and scoop through the anus to check the prostate and all that. But we still do that, but not regularly, all right? Because now we have the ultrasound scan, which can detect some things. And even the ultrasound scan, it has a rectal probe, which instead of finger, we use the rectal probe into the anus, but not all the time. But the simplest one we preach to every man over 40 is just do the PSA test. That's the simplest one that could give us a guide. Then we can move from PSA, then we can now move into the intrusive test.
Are there lifestyle factors that increase prostate related risks?
Oh, yeah. We always say healthy lifestyle, healthy eating, healthy habits will make you stay away from disease, all kinds of disease. So, what's a healthy lifestyle? Your regular exercises, eat right, There are some kinds of meals that are protective of prostate cancer. For example, we from the Niger-Delta, but well, things that oil pollution and all that. Well, I don't know how far that has affected our periwinkles, our seafoods, because seafoods are preventive of prostate cancer. Our carrots contain carotene, which also helps to prevent prostate cancer. Our tomato has lycopene. Fresh tomato has lycopene, for which we advise that once in a while you can just slice the fresh tomato, eat with your bread, and you're good. The green tea, the tea that you can put green tea in your tea and you drink. Green tea is very protective of prostate cancer. So these are fresh fish, our seafood, native soup, and all that is protective of prostate cancer. All
So
right.
you mentioned lifestyles that protect you
Yes.
from what lifestyles bring it on?
Bring it on. Well, the from the time we started studying medicine, they will tell us that the cause of cancer is unknown, but there are many factors associated with cancers. I would say one, the aromatic hydrocarbons, like in Niger-Delta, the flaring, all those chemicals from the chemical industry, it can lead to cancers. Then I mentioned the testosterone, the male hormone that converts the inactive agent to the active agent. It all works and resides inside the prostate gland. There's one they call mutation. Mutation, a cell can just be there and it changes itself and becomes mutated to a cancerous cell. All right. Then even the fats in our body can also help to add to cancers. Smoking can also cause cancers. You know, so there are many things that can associate with cancers.
You referred to genetics
Yep.
a while ago. So
Hereditary, yeah.
if there's a history, a father, an uncle, brother in the family who's come down with prostate cancer, am I, pardon the expression, doomed?
No, 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 no. You're not doomed. Nobody is doomed that one has cancer. The important thing is that you're doomed if it's an end stage cancer. That's why we talk about screening. So when we screen, we can catch cancers that are early, and then there's a cure. Because if it's early prostate cancer, we can do what we call radical prostatectomy, radical removal of the prostate, either using a robot or use laparoscopic, or we use a knife. Once you've removed that, then I will say to 90% plus, you have a cure. And that's an early prostate cancer. But if one comes late, we have a term called palliative. So we're going to palliate. That's where it now has to do with removal of the testis, which is castration. We need to castrate the man so that we can reduce the source of the testosterone from the testis to the prostate. And other medications, which are very expensive. Injections that we give once in every 3 months or once every month. Tablets you will take once every day for 2 years and above. Some of those tablets are up to 1 million a month.
Wow.
Some of the injections are up to 500,000 every 3 months. Okay? And the surgeries are expensive. So we don't want men to get to the point where you start draining all your resources to treat prostate cancer. That's why I'm an advocate of screening for prostate cancer.
We'll come back to this. I will follow up on this in a moment. However, the question I asked about genetics. So, if a family member or there's a history in my family,
Yeah.
so I won't use the word doomed again.
Mm.
Is it inevitable that I will come down with prostate cancer?
No, 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 no. It doesn't follow that the person will come down with prostate cancer. But out of four sons, one out of four, or three out of four, or all the four may come down with prostate cancer.
May or will?
May come down with prostate
So
cancer.
all four may not.
All four may not. But once there's a history of genetics bearing the cancer gene, then it behoves of the descendants to screen even more for the cancer.
Cancers generally, it's a borrowed expression used a while ago, is a mutation of body cells.
Cells. Yeah,
So,
exactly.
so whatever that mutation happens is what describes what kind of cancer it is, basically, I suppose.
Yeah.
Would that be a correct statement?
Yeah, it's a correct statement. If that mutation occurs around a particular organ, then the cancer takes the name of that organ.
So when you say that prostate cancer can be cured, so I will take that even further and correct me at any time.
Yeah.
That means cancer can be cured.
Yes, cancer can be cured.
So if a cell has mutated, can the cell be restored to its original form or its original state, which may be considered a cure? And if that cannot happen, how can cancer, prostate, or any other kind for that matter, be said to have been killed then?
Once the cell has mutated in that organ and it's said to be cancer, the cure is removal of that organ.
In this case, the prostate.
Yes, remove the prostate. We cannot remove the mutated cell. We have to remove the whole prostate together with the cell.
Okay, let's go back to the analogy you gave a while ago of taking your car to
Repairs,
for
yeah.
repairs or servicing,
Servicing it.
periodic servicing.
Yeah.
Um, okay, I was going to say no offense, but I take that back. With great offense to some of our mechanics out there,
Yeah.
and you may have experienced one or two of those, who you take your vehicles to, and in the habit of advising you to remove a certain sensor. Okay, let's remove that one. And you say why? And say it doesn't do anything. Then you ask them, but the manufacturer of the vehicle put that sensor in there for a reason. It must be serving the purpose. And they say, oh, it doesn't do anything, Oga. Let's remove that. Remove the sensor. And then they remove the sensor eventually if you're convinced. And then the car is never the same after that. The prostate, I presume, serves a purpose like the sensor. The prostate is not just there idling away. It must be serving some purpose. So if the prostate is removed by virtue of, the incidence of prostate cancer, doesn't that take away something for the body, and how is that function replaced?
Yeah, it does. It does. It does a lot. The function of the prostate, it serves in the nourishment of the sperm that is used to fertilize the egg in the woman for reproduction. That's the function of the prostate. So now, when the prostate is removed, childbearing is off. A man can never impregnate a woman. And when it is removed too, sometimes some very vital nerves are damaged because of the removal. So the erection of the man for copulation is gone. Okay? But in recent times, there are very many specialized kind of surgeries now, which are called nerve sparing prostate removal. Okay? So in that nerve sparing, those nerves that subserve erection can be preserved. So there will be erection. Again, in the total removal of the prostate, the patient could also develop urinary incontinence for a period of time, but it's, it stops. So there are sequelae to even the prostate removal. But if you want to compare that with the cost of your life, it's better to remove it. And you now handle the other sequelae. You can always adopt if it's children that you want. Or we can take the sperm directly from the testes and do an IVF.
Which is also very expensive.
Not very expensive, but I mean, it's not as expensive as your life.
So, as will inevitably happen with some men, uh, you go to your doctor, maybe just for routine check, or you have some symptoms that concern you, and you're going to see a doctor as well, and you're diagnosed with prostate cancer. Sadly so.
Yeah.
What next? And because you said a while ago, it's not doom, it's not the end of the
That's
world.
not doomed.
So
Yeah.
what next?
If one is diagnosed of prostate cancer, it's not the end of the world. Listen to your urologist, have an open mind, do other researches, seek second opinion. But at the end of the day, you may come down with options, which may be and external beam radiotherapy, radiation to the prostate with super X-rays to kill the cancer cells without removing the prostate. Or with what we call brachytherapy, we implant radioactive needles into the prostate that will be releasing radiation gradually around the prostate to kill the cancer cells. Therefore, the prostate is left intact. All right? But the functionality of it is what may not be 100%. All right? The erection purpose may or may not be there because sometimes the radiation also destroys the nerve endings to the from the prostate to the penis. All right. So there are options, and there's another option we call watchful waiting. Do nothing. Just keep monitoring the cancer. Some prostate cancers are not violent. Some are not ferocious. Some are calm. Some are occult. Some are indolent. Some are not aggressive. So the non-aggressive ones, and particularly if the person is, let's say, about 80 years old, how many more years does the person have to live on earth? So you just manage palliative, and the person will may still live another 10, 15 years. I've had patients that have lived 20 years post cancer
And
treatment.
can still have a child.
At
The-
80, yeah,
I
yeah,
mean,
yeah.
there was
It's
a
still
man,
possible at
there was a
80, yeah.
musician. I don't remember. I think it was. Uh, oh, no need to mention names. But there was some musician in the West, in the
Yeah.
Southwest, who was said to sometime in the 70s is still
It's still
still fathered
producing.
a child.
Oh yeah, yeah.
Yeah.
I have friends whose who's their father's child is their, hey, how is it? No, who's their father's child is their uncle. How is it again? I know uncles. Okay, I know
Yeah.
friends
Yeah.
whose uncle's son, which is 5 years old, is their own uncle also.
Wow.
So some people can have children. After Abraham had a son at 100.
Mhm.
So it's still possible. The men can produce as long as he lives, unlike the women. So, but I mean, if that is the wish of the patient, we can grant the patient the wish.
Is there any particular care that the patient should take if you see your doctor and then there's a suggestion that you may have prostate cancer? What should the lifestyle then be? Is,
Yeah, well,
whether or not you have a procedure or you're doing the watching thing you
yeah,
described? Yeah.
the lifestyle, I would say, just know that it's not doomed. All right? It's not a doomsday. You still live your life, but now with much more responsibility on you to live healthy lifestyle. Start your exercises. Have a gym instructor. There are some at certain age, it's only bricks work. Gardening, all right? Take your mind away from the problems, all right? Why you still see your doctor? Live your life simple. But if it is end stage cancer, we also tell our patients you don't have much time to live. So you make peace either with your creator or you make peace with your fellow human being and just set the records right before you leave. But before you leave, keep seeing us. We have the power to extend your life for certain years like that. We keep extending your lives until the creator takes you.
A concern for many persons with most ailments, including cancer related ones, prostate inclusive, is surgery because they are, or at least at some point, used to be mostly, if not entirely, invasive. But I hear that we have some newer techniques and advancements in the medical field that offer some options as well. What may those options be?
Yeah, because of the complex and the complications arising from the open surgeries. There are newer methods now. I'll start from the least to the highest. We have what we call the HOLEP, holmium laser enucleation of the prostate. Which we use laser to work on the prostate. We have the laparoscopic. Laparoscopic is a pinhole surgeries. to remove the prostate. Now we have the robotic. So the robots can do the surgeries for us, which we will work with the robots. So it's a robot assisted radical prostatectomies. So these are surgeries where we remove the prostate and the patient go back home the next day, or at most 48 hours. Patient is back to his activities, and and even the patient will not even know that he had surgery.
We'll not be walking around with our legs
We'll
spread
be
wide.
walking around normal, normal. You can even come back to your office here and take your photo shot and whatever you want to do. That is the technology that we're in now.
But imagine these newer procedures are expensive.
Though they are very expensive. They are very expensive.
So,
But still affordable.
what options are there for those that can't afford these expensive procedures?
Yeah, we can do the old method, which is taking out the testes. We'll take out the testes.
No. But as we wrap up the conversation, it seems it's very clear that the perception that what you don't know kills you is very wrong. And if you don't know this, it'll probably kill you faster than if you did know.
Yeah.
So, what's that final one message you leave with our listeners, especially male listeners or viewers right now?
My final message is to encourage every man once you're 40 years to go and see your doctor. It's very important. Prevention, they say, is always better, cheaper than cure. So the earlier you take your body to the doctor for regular servicing, at least once a year, you will find out that once you make it a habit, you will live a healthier life.
What if it's not my portion?
Oh, no, no, no. Please, can we just put that behind us? There's nothing like it's not my portion. There's nothing like that. It's not my portion. Otherwise, it is not anybody's portion to die. But the Bible says it's appointed that every man should die. And after death is what? Judgment. So why don't I say it's not my portion? Except Jesus Christ comes, everybody will die. The next 100 years, you will tell me where you will be.
Not to wrap for this episode of Converse in Niger-Delta Roundtable, we've had the prostate conversation, one I presume that many men either don't want to have or are scared to have or would rather postpone having that conversation, but one that you must have, and the earlier you have it, the better. Thankfully, we've had the pleasure of Dr. Jack Omodu in the studio to have that conversation with, enlighten us. I'm sure you're very enlightened by it already. Prevention is better than cure. Dr. Jack Omodu, many thanks for your time.
Thank you very much.
I'm Dialu Shakin. Thanks for watching and listening to this episode, and bye for now.